Welcome back to the Brain Injury Discussion. This is Jay. I hope you are all well, and of course, like always, the sources will be in the description below. Feel free to like, subscribe, and if you have any suggestions for future topics, feel free to do so. Feel free to put those in the comments. We are going to get into therapy or therapeutics for brain injury today. And this really covers a lot of different areas. And what I found on this was fairly significant. There's a lot of information out there, and some of it can be confusing, but some of it really boils down to what is currently out there and what is currently known, and what is currently being explored. So there's a lot of it to cover. So let's get into it. An article titled "Current and Potential Pharmacological Therapies for Traumatic Brain Injury." This is out of the magazine Pharmaceuticals out of Switzerland. They found that there are millions of brain injuries every year, and therapy and therapeutics play a big role in brain injury treatment. And they note specifically these treatments range depending on the nature of the brain injury, depending on the mechanism of injury, and there's a lot that has already been done to treat the symptoms of brain injury or the after effects of a brain injury. So obviously there's stuff, and they're specifically noting like symptomatic treatments, but there's also up and coming treatments that are coming out. And when this was written in 2022, they were exploring corticosteroids as well as other, supplementing vitamins and minerals. They were exploring statin drug use, and there were a slew of other medications. Coagulation and anticoagulation might have a part to play in brain injury. So obviously, a lot of this is depending on the brain injury itself, and the list was just exhaustively long. But notably, um, currently there's a lot of things that are being used for other symptoms like the memory fog, the brain, other things that come from the brain injury. But there's a lot of things that are being explored. And when this was written, Botox was one that stood out to me. Botox, it's an injection of botulinum toxin. That one stood out for me for some odd reason, but that has been used to treat headaches, and who's to say that doesn't apply to brain injuries. They also note that some therapies have also come into light that are being avoided. Specifically, they note benzodiazepines as being avoided for brain injury, which, again, that's a medication issue. I'm not a medical doctor, but I can see why they would want to avoid certain therapies and treatments. Same article, Medicines based out of Switzerland, an article titled "A Modern Approach to Treatment of Traumatic Brain Injury." They make a very sentinel point in their 2024 article that says that there are no miracle cures for brain injury. There's no one size fits all. Just like what you'll hear myself and other case managers for brain injuries say, there is no two brain injuries that are the same. They're all unique in their own way. And so they note that there are no miracle cures because obviously, a stroke, anoxia, um, concussion, they're all very different. So the treatment, the first, immediate treatment, and then maybe some of the intermediate treatment, um, all of that can be very different depending on the nature of injury. But, they were listing a lot of not only treatment measures but also preventative measures. So they mentioned preventing the pneumonia from the ventilation that it might be needed if you're in a coma state after a brain injury. Um, because they say yes, ventilation might be good, might be needed, but you don't want to get the pneumonia from the ventilation. So obviously, with a lot of treatment, there's a lot of give and take. There's pros and cons to everything. So managing, preventing seizures without going too overboard on the medication to do so. Managing the body temperature to make sure that it's at a healthy level, not too low, not too high. Managing blood pressure, same thing, not too low, not too high. Making sure that there's fluid management, making sure that there's enough fluids in the body, especially if there's too much fluid or maybe there's too little. They also mentioned tranexamic acid, which is interesting because that one is quite a widespread use one, but that one's used for hemorrhage a lot. They note steroids, just like the previous article. They're exploring steroid therapy, hormone therapy. So obviously, getting into the endocrine system, the immunosystem. And they also talk a lot about the pharmaceuticals that are being used, but there's also pharmacologicals being used. The one that really stood out to me in this article, which maybe, made me like just jump out, just, put that little flag up in my head. Two things actually. Hyperbaric oxygen, which will be in another episode because that one really piqued my interest. And then they also mentioned kind of Eastern medicine, which is more associated with like China, Japan. They associate that with like non-traditional medicine as what we look at it, even though it's actually more traditional than pills, pharmaceuticals, therapies. So they're talking like acupuncture, acupressure, herbal and medicinal supplements. This article just generally, lists a lot of these treatments out, and it all kind of depends on the nature of illness and also the mechanism of the brain injury. But, there is no miracle drug, and there probably will never be a miracle drug for brain injury, but there might be, little small miracles within treatment of brain injury. So, the one that was really stuck out to me was hyperbaric oxygen. And, obviously you got to give and take. There's always pros and cons to treatment, no matter what it is. And those have to be weighed between the person with the brain injury and their medical provider. So, again, things to think about. That is very interesting. A article written in 2018, um, titled Supplements, Nutrition, and Alternative Therapies for the Treatment of Traumatic Brain Injury. It was published in Nutritional Neuroscience back in 2018. Um, they looked as far as like the intake of nutrients, supplements, and all that. And obviously, they note that there are certain morbidities associated with traumatic brain injury, such as like neurodegeneration. And the term sequelae comes up a lot in this article. Sequelae basically is talking, it's used in diagnosis codes as secondary effects of something or a secondary visit to. So, sequelae is definitely an interesting thing to think about. But they started really focusing on the nutrition, and there were a few things that really jumped out at me. Of course, I've already mentioned Eastern medicine as far as acupressure, acupuncture. They mentioned meditation, hypnosis, positional medicine, yoga, kind of the what we look at as non-traditional, which is probably even more traditional than our traditional medicine. They also talked about vitamin D, not just the intake of vitamin D, but also it's the absorption of vitamin D. And this made me think back to a while ago where I was in Navy Corpsman School, and they talked about nutrition. And it's not necessarily what you're just putting into the body by way of your mouth. It's also got to be digested. And, if you're putting in a lot of different things, like you're putting in all the good stuff, right? Your body still needs to take time and digest it. So it's not necessarily just that you eat the right stuff, but you also got to be able to absorb the right stuff. And so they mentioned increasing vitamin D intake as well as maybe looking at different ways to absorb that extra vitamin D, not just from the sunlight, but also from different pharmaceuticals. A couple other like supplements that pointed out, and again, this is all I would recommend you talk to a medical provider about it. Vitamin D was the one I was talking about. D as in Delta. Vitamin E as in Echo. Vitamin E is very important to the brain as well as vitamin D and all the other vitamins. They said maybe, okay, this article points out to zinc and how important that is. Maybe, they talked about the omega 3s and what role that plays in brain maintenance, really. But they also pointed to some non traditional stuff, and it really came down to, they're talking about the stuff that is aside from pharmaceuticals, pills, injections, et cetera, et cetera. And so they note that that is very, important to brain health too. It's not just the pills, it's also what you're eating, it's also your hydration, it's also the supplements, it's also the other stuff that you do for the brain health. So, taking these three articles together, and we start thinking about Okay, what is the future of brain injury management? Well, we can see that, there's this kind of recurring focus where they're starting to phase in new things. They're starting to test new things. Hyperbaric oxygen is probably being tested very, very frequently now. Eastern medicines such as acupuncture, acupressure, meditation, hypnosis, vitamins, minerals, nutrients, nutrient absorption, good nutrition. All of that is being, looked into very heavily. And of course, they're phasing older things out, like they're phasing out the benzodiazepines. They're probably phasing out some of the older medications that maybe don't have as much promise, or maybe they're reevaluating some of that. And I once was told that medicine is a practice. I'm not a medical doctor, but my clinical background, my medical background from the military, they told me that medicine is a practice. You practice at it because it will never truly be perfect. uh, but you can always there's within a practice there's always things to learn, there's always things to practice. So obviously take it easy on the doctors there's no way you can know everything, and I do not aspire to know everything in this subject. But just giving you like a little bit of a brief synopsis is that yes, medicine is moving forward, and the recurring themes are there. We're phasing the old stuff out, we're bringing in new stuff, we're trying other things that we already do have, we're trying out new things. So obviously, sources will be in the description below if you want to look through these articles yourself, and I encourage you to do so. And of course, if you have a question about medication, obviously talk to your doctor about that. But feel free to like, subscribe, leave a comment. Maybe there's a supplement that you take that you feel like helps. Maybe there's something that was recommended to you, or maybe there's something that you found doesn't work. If there's something that you find doesn't work, feel free to put that in the comments too. We'd love to hear it. And of course, again, recommend that you talk to a medical doctor before you change your medications. Talk to the doctor about any medications. So, that being said, I hope everyone has a great rest of the day, and do take care of yourself and your brain.